Our next speaker is Alexia Cumal, who is a PhD student at the Lawrence S. Bloomberg Faculty of Nursing, with a talk titled Walking with Care, a nurse-led intervention for older adults with dementia.
Imagine yourself being hospitalized. You stay in a hospital bed for days and days, struggling, working hard to recover from your illness. But by the end of your hospital stay, your leg muscles are now so weak from having stayed in bed for so long. You're no longer able to walk or go to the washroom on your own, and you feel awful. Now imagine that on top of all of this, you have dementia. You don't know where you are. You don't know the people around you, and they don't. This is the reality facing many older adults with dementia after a hospital stay. Many of these patients transfer from hospital to transitional care units, where they have worse outcomes than patients without dementia. It is in these units that they need help. I am a registered nurse. For my PhD study, I'll be evaluating the effectiveness and feasibility of a novel nurse-led mobility intervention for older adults with dementia in transitional care units. This intervention consists of 3 parts and will all be delivered with care. First, I will assist older adults to perform sit-to-stand activity, which should increase the muscle strength in their legs. Second, I will engage older adults in a walking program for a total of 5 sessions per week for 6 weeks. This is expected to improve walking ability, the ability to perform activities of daily living, such as going to the washroom, as well as quality of life. And third, I will utilize a patient-centered communication care plan. This care plan will be informed by interviews that I will have with the patient as well as their family member. Together, the interviews and care plan will help me to get to know the patients better, will help them to feel more comfortable working with me, and should also increase adherence to the intervention. Based on the results of previous research, which tested 1 or 2 intervention components with older adults with dementia in different healthcare settings, this 3-component intervention is expected to result in an improvement to all aforementioned outcome measures showing effectiveness, as well as to result in a high adherence rate showing feasibility. Given that the population of people with dementia is expected to increase to over 150 million globally by the year 2050, this intervention has the potential to impact millions worldwide. Now imagine yourself having finished this nurse-led intervention. Now your leg muscles are strong. You're able to walk and go to the washroom on your own, and you feel so much better. Wouldn't you want the same for older adults with dementia?